What are some of the nutritional deficiencies that cause seizures or epilepsy?
Some of the ones that are good for neuro is like vitamin B, B1, B6, 12, and quite a few of the Bs as well.
The effect it has on family members and the individual going through that. Usually they go through stigma. Can this prevent someone from seeking help?
Now, it should not be a prevention from them to seek help. They should realize that help in that manner is way better than them feeling embarrassed. When somebody having that kind of a seizure, what do you really do?
When someone suddenly falls down and starts shaking, the first thing that comes to mind is the person is epileptic. Now, what exactly is epilepsy?
Okay, so epilepsy sometimes are disturbances in the brain where we have electrical charge and it's not corresponding properly with the head, with the brain.
Okay.
So it could be that the person have an injury. It could be that the person have a nutritional deficiency.
Okay.
Yeah. It could be also that the person are not managing stress in their life properly. Yeah. So it could be a number of things that causes epilepsy.
Okay, so you made mention of nutritional deficiency. What are some of the nutritional deficiencies that actually cause seizures or epilepsy?
Well, it could be a number of nutritional deficiency. Some of the ones that are good for neuro is like vitamin B, B1, B6, 12, and quite a few of the Bs as well. Also, it could be zinc, a deficiency of zinc, and it could also be calcium, magnesium, both of them as well. And it could be also folic acid that is missing from the person's body. Now, it could be, there could also other that are short in the body. So when people have epilepsy, oftentimes when we do a test, a blood test, we find that there are some of these are the main minerals or vitamins deficiency that we find in the person's body.
Okay, can you throw more light on what exactly happens inside the brain that makes the person lose control, focus, or the person is confused?
Yeah, well, there's a way to put it. An electrical way of saying the person short circuit. So that sounds like electricity, short circuit, meaning that the brain for some reason are not functioning properly with the nervous system, or it could be that for some reason the person have an injury, a head injury, which affects the brain. Then that could go down to as to why blood clot. So if the blood is clot between certain part of the nervous system to the brain, where the connection is supposed to be between the barriers of the brain, then yes, we have a problem. That person have a problem.
Okay.
Yeah. If they are also stressed out too. Yeah.
Doc, let's clear this old argument about using spoons.
About
Using spoon. You put a spoon in somebody's mouth when the person is having a seizure.
okay.
Yes, and I see that most often, when people are having seizures. Is it really helpful? Is that the right thing to do when someone is having a seizure?
It is not so safe because whenever someone have epilepsy, one of the things that you want to do is to remove all sharp object away from them. The next thing is do not put anything in their mouth. Because when they have epilepsy, oftentimes the mandible against the upper jaw is very tight. So they tend to bite. So you have to know what you're doing. And then it will bring us back to, there are things you can put in the mouth from a natural point of view. But then if the person locked the jaw very tightly, then, no. And this is why we said don't put any sharp object near the person. Once a person starts having that seizure, that epileptic seizure, you want to remove all the sharp object out of the person's possession. So, and put nothing in the mouth. One of the things people generally do is to take off the shoes and then cover it over the nose or the face. Yes, and I've seen them people use that and it will work. Yeah, it does. But there's another way, as I said, if you're not putting sharp object, you move that away from the person. The thing that I was talking about you can put in the mouth is certain tincture. Like for example, cayenne pepper tincture. Yeah, if you can open the mouth by squeezing the jaw and it forces the teeth to open, then you drop it under the tongue. It promotes circulation. And the person's going to.
Okay. Is it also appropriate to raise the person's head? Usually they fall down flat on the floor, and people, they put pillow under their head. So is that also medically required to do as first aid?
Well, if you put a pillow under the head, is sometimes, if you look at it from a point of view, you could realize that the person is probably trying to avoid that person who put the pillow is probably trying to assert that the person who have epilepsy, they call it rustle, where the person started to shake, it's rustles. And then sometimes that shaking depends on where they are. It could cause a lot of scar all over the face, depends on how the person turn as well. So we can also go down and say, we can go further and say, when somebody having that kind of a seizure, what do you really do? So you're talking about what do you do, right? So as I said before, you remove all sharp object. If you can put a pillow, yes, you could, depends on where the person are. Because I was just driving on the road, I think it's about last year, and somebody just, we was in the vehicle and the person fell at the side of the road. And we saw that is what was happening, but my driver didn't stop. But where the person fell, there was some stones right there, sharp stones. And I could see where they're kicking. So if that person face turned down on the ground and they're going like this, that could cause a lot of damage to the skin and the face as well. So yeah, it depends on where they are. If you put it there just to help them from not damaging their body, their skin or something like that.
Before we move on to the treatment options, let's talk a little bit about some signs and symptoms to look out for, to notice that my child or this person is having epilepsy or is going through seizure.
Sometimes it's not easy to see. Some people, you just don't see it because they will feel a certain way, but they would never say it. Some folks are like that. But the person themselves can be able to tell you oftentimes that they are going to have a seizure. So for example, you started to feel like you're sweating, you start to feel more stress, and you feel like your body flushing, right? Now, that flushing is when you're having a particular one, which is called psychomotor epilepsy. Okay. That one will do that. Your body starts to flush. And then, shortly after that, your heartbeat started to raise higher. And because of the heartbeat going up, it's beating faster, it then leads to you to have a high blood pressure. So high blood pressure, the heartbeat going up, and the body started to flush. They can feel that is coming on. But most people, instead of them saying it, they just keep quiet. And then after that, they go into what we call, people says rustle, and then they start shaking. Then they went off like that. Either they fall, lost consciousness, or something like that.
Now let's discuss more about the types of epilepsy. Is it every kind of seizure that is epilepsy?
Well, not really. There are seizures where people just pass out. Okay. They don't shake. They don't have that at all. And therefore, sometimes you can actually misconstrue those kind of seizures with epilepsy. It doesn't have to be epilepsy.
So what are the differences?
Well, one of them you shake like hell. Mm-hmm. The other one you don't at all. So for example, we have a patient here 3 years ago who for 9 years, she was just falling. So she would just be walking around and then just drop. And then her eyes just turn over and then she's gone out, just passed up like that. And thank God when we work on her, it took us about less than 2 weeks and she was okay. She never had it again. But that is not epilepsy. That is just like somebody having a kind of a seizure with a pass out. And don't forget, when somebody do that, you have to understand, you have to look for a few things. Clogging. Some part of the, like where the brain is concerned, there's a lot of nervous system that goes to it. We have certain flowing of the blood that goes to certain part of the brain. Sometimes it could just block, and then that is why they pass out.
There are many people who have the silent seizure. Yes, so I've witnessed a number of cases like that where someone just stares into space. The person is just staring for a couple of minutes.
Mm-hmm.
Yes, and usually if it's a child, they are like the person is daydreaming. Meanwhile, that could be a serious brain issue. Yes, so I want you to throw more light on that for.
Yeah, well, there are different people who come under attack from different kind of disease like epilepsy and so on. They never always act the same way. That's why you will find that someone will sit down and they just go, right? But it is because they're sitting down. Some folks too do stand up, and it's like as if their mind went, right? And they go for a short period of time and they come back. It's just like they are having it could be also to like a mild heart attack, and it's not really epilepsy. And it may not be also a seizure so much, but it could be an heart attack as well. So as I said before, if it is misdiagnosed, you might call epilepsy something else, and you might call something else epilepsy. It all depends on what it is.
Okay, so now let's move a little bit away from the seizure itself or the epilepsy itself to the effect it has on family members and the individual going through that. Usually they go through stigma, especially students. When you faint or you suddenly fall down and you're jerking and all of that, and then after a couple of minutes you wake up and everyone start looking at you like, what just happened, something is wrong with you. Can this prevent someone from seeking help? I mean, the embarrassment from how you are checking and all of that, can it stop someone from seeking help?
Well, it depends on the individual. If the individual because they feel intimidated because so many people is around them, if they feel ashamed because they're falling, some people do look at things differently. Now, it should not be a prevention from them to seek help. They should realize that help in that manner is way better than them feeling embarrassed. Because if it should go worse in life, further on in life, it get worse. Sometimes you could go off and never wake up, right? So it is best for you to, for example, you find that this is what is happening and you wake up seeing so many people standing around you. One other thing too that we notice is whenever you're having epilepsy, you have a lot of people who don't know what is really going on, so they crowd around the person. It is not the best idea. It's not the best thing to do, especially when the person have a seizure or an epilepsy attack into a closed room. Because whenever the person do that and have that attack, one of the things the person really want to have is oxygen around them, because oxygen is required for the brain to function better. Now, if the oxygen is not enough in that room because there is a crowd of people in there and they themselves are breathing it in, breathing it out, leaving her to be breathing on carbon monoxide, which is poison because they're breathing in and out. It's not helpful for that particular person. So one of the things they need to do too is to clear the area. Only those who can handle the situation should be right there. And it's for one reason too, when a person have epilepsy, it is good to loosen the clothing, open up the chest, move that the person can breathe properly. Why breathe? They need oxygen, they need air. They don't need to be tightened up or locked off. So people standing too much around, I know most people, they are curious and they want to know what is going on, right? But it's not, if you know how to handle it, then you have to tell them, please just stay off of it. it is best for them to do that.
If you're still with us till this point, I want to encourage you to like this video, share to your friends and loved ones. This might help somebody. Thank you. Doc, now I want us to talk about the treatment options. Are there natural remedies that can reverse this condition?
Yes. And oftentimes, doctors, like I would say, an allopathic, an allopathic doctor may not know much about these things, but we who are naturopathic know about it. You see, there are different kind of epilepsies, right? You have the grand mal epilepsy. You also, you have the psychomotor epilepsy. You have the autonomic epilepsy. Yeah, and you have another one too as well. But it depends on sometimes which of the epilepsy that you have. These are oftentimes autoimmune disease, so you have to treat it like autoimmune disease. That's what it is. So if we're going to attack it, we oftentimes go for whatever medicine is very good to nourish the brain, right? Now, for the grand mal epilepsy, you lost consciousness. You don't know what is happening around you. So it's not all of the epilepsy that you will lose consciousness. There is another one that when you have it, you are conscious. You know what is happening around you. And then, there's one of them. You know what is happening around you. And then there's another one, your body started to flush. And then your skin would turn white. It do. And then there's another one too as well, but they're all epilepsy, you know what I mean, regardless of which one they are. Now, it is good to know that we can use things for the brain, such as people hear this superfood. Mm-hmm. Yeah, well, you can use a lot of stuff for it. So don't forget, we don't know why the person having it, so you have to ask questions. Like, for example, when the person comes back, to their normal senses, you ask them, well, is this something you always have? And they will tell you yes or no, right? So if it's the first time, then they might go. You have to go further and ask them, did you ever suffer an head injury when you was growing up or for some time in the past, not too long ago, whenever it is? And then you have to try and find out, is it after you have the head injury, you started to have this episode? And then they will tell you. Now, if it's not that, then you have to go to something else. Now, regardless of what it is, you have to know how to do anticoagulant. Now, anticoagulant are like calcium, magnesium, like high dosage, 2-to-1 ratio. Mm-hmm. Then also vitamin C, high dosage, 8 to 10,000 milligrams per day. You can do things like that as well. Folic acid, you have to apply that. Herbs, ginkgo, ginseng, brahmi, skullcap. Those herbs are literally for the brain and for the the head, and so on and so forth. Then you have to look again in the person's life while you're applying these things, if they are attributing any bad habits. Because there are bad habits too that can cause this coagulant in the body. High sugar content, high artificial flavor. They are drinking things like Fanta, which giving you artificial flavor, artificial coloring, preservative, additive. You have to eliminate these things from the so-called diet that they are eating. And then now you have to find out, are they drinking alcohol? Are they smoking? And this kind of a thing, bad habit that they are following up. And then these things can also attribute to some of these problems. So you have to move those things. So it's not just what is good to give, but you could be giving the best thing in the world, but if they don't remove what we call the cause, how can there be a cure? It wouldn't be. So listen, going to the bed too late at night, you know what I mean? Eating and drinking heavy food such as, eat a whole pizza. You eat Kentucky Fried and these heavy fat, and then you go to bed, lie down. You never know what it might do, right, in the body. So you have to remove these bad causes. Then you implement proper, healthy condition for the person's body.
Okay. Talking about the causes, say a seizure or epilepsy is caused by trauma or brain injury. What medical treatment option would such a person go for?
Well, we are on the natural side, so we're not talking too much about drugs. that person will better do a DNC or they will do a CAT scan if they want to do it. I don't actually talk too much about X-ray. I would prefer to say a CAT scan or an MRI, a little bit less invasive. And then the brain is what you want to look at to see if there is any blood clot which run to the main artery and some of the main artery that goes to the brain itself, right? Sometimes you have to look and see if the vena cava is blocked. Since it goes up, down, you have to see if that is a problem with that. And then you have to actually check and find out if the autonomic nervous system, the central nervous system, if they are in check properly. You have some ECG, you have other things you can do to find out. You have certain tests that we do, which is stress tests and all these things. We do those to find out if something wrong. Then we have to look to find out if it's heavy metal toxic. That can cause a serious problem in the person's body because there could be the cookware they're using is lead, which lead poison, aluminum oxide into the food, and they are consuming these things which the body don't know what to do with these heavy metal, and it stores it up, and then it gets into the main artery, then it goes to the brain. You never know what it is. You just have to hunt. We have to be like a detective, and that I always say this, especially naturopathic doctors, drug doctors too, which are allopathic doctors. They too have to learn to be good detectives to find out where is this coming from, where is that coming from. But yes, those factors you have to put them into consideration.
Okay. Is epilepsy hereditary? Can it be inherited from ancestors?
I wouldn't say so much inherited more than how I would say hereditary in a sense, because only have a chain. It could be a food chain, it could be a lifestyle chain. It could cause a problem. But in most cases, it can be the lifestyle that you have. Like if I have seen great footballers who play football, and after they fell and they get certain damage, then you find that retirement goes into epilepsy. And sometimes it's not just epilepsy, but it's like Parkinson, which is a kind of type of that family as well. A good case is like Muhammad Ali. Muhammad Ali, if you notice, even in his older age, when he appears, he's always shaking. So that tells you from boxing, he suffered really good head trauma, and that result to such a thing. He didn't inherit that from anyone. That is just from his job. He was a boxer, and that was the result.
If someone is already on medication to manage epilepsy, if the person starts, dieting properly,
Okay.
can it stop? Can the person eventually stop taking the medication?
If they are on dieting,
Yes.
well, it depends on who put them on the diet. I have an automolecular medicine. I have a PhD in automolecular, which is medicine, mind, and body. So if I have to do something like that, then I would do it cautiously and do it in the proper ways, right? So you have to know what you're doing. Not just anyone can just take somebody off drug and then put them on something else unless they really know what you're doing. Now, for us, we do IV as well. So you could put certain things into IV and then put it in the body. So yeah, it depends on who. You have to know what they're doing though. And the person themselves would have to agree to what they're doing.
Now, for someone who is managing epilepsy or going through it, but the person has nobody to speak to, right? Because of the fear of judgment.
You said the person don't have anybody?
Yes, the person fears judgment or stigma, right?
Are you saying that they are afraid to be
They are
judged?
yes, because usually in our society, if you are epileptic, it's like I don't know, somehow they feel like I can get it to you, can transfer it to me, or they just don't want to associate with you.
Okay.
So those people feeling lonely, what piece of advice can you say to such a person right now?
I've always said this. I have seen people who have disease, and while they have the disease, they kept it until they die. Like especially when you talk about, they don't even want to call the word, they said the big C. So they're saying it's cancer that they have, right? So anybody who have that, they are afraid because to them it can't be reversed. Well, that's not true. The next thing is if you have a certain ailment and it's a problem, you should not think about what other people thinks about you. It's you that are sick and not them. They can however way they want to feel. They can however way they want to judge you. They can however way they want to alienate you. But there is one thing you know. They are not the one with that ailment. You are. So you have to know that you need to seek help, not them. So whichever way they want to do it, that's their trouble. Sometime down the road, they may turn around and realize, what we're doing is not good. You see what I'm saying? So, the person need not to feel alienated, so judged, being afraid, being intimidated, and all these kind of things. No. They need to, because sometimes too, by just mentioning what their problem is, somebody could say to them, I know someone that can help you. But because they never say anything and they keep quiet, and they feel like they've been ill, they keep quiet, nobody know what's going on. And I realized too that within the African continent, that is very plenty. Very plenty. People so easily feel ashamed for their ailment, like as if it's their fault. No. You need to speak up. Somebody came to me and they said, they came here for medicine, and I said, who told you about here? And they said, I was in a taxi. And somebody said to me, I was telling them that I was so constipated. I go, so you were talking? This is it. And the person said, you could go see Dr. P. And she asked, for what? And she said, you have something that when you take it, it makes you go up to 10 times. She came right here. But she was talking.
That's a very powerful one, Doc. What are your final words for our cherished viewers? I want you to talk about how to handle those who are epileptic. Especially their families and those they are living with. How to handle the victims.
Well, first of all, because I'm in the continent of Africa, I will say, do not judge when someone is having epileptic problem, like their epileptic disease. Do not always believe that, that is juju. I don't know where this thing coming from. You know what I'm talking about. Everything is juju. It's never always this juju. No, it's not. The next thing is don't alienate anyone that is having that as well. Let people able to speak about what is happening to them in their lifestyle, that they may be able to get help. And also, if you find that the person is having this, if it is you or if it is somebody else that always, tell them to go and seek help, because there's a lot of ways you can get help about it. But those who need help, and I am giving an advice to it, I would say that they should see a very good naturopath, one who have very good experience. One of the things they could do is to find out if there's any minerals or vitamin that is short in the body, that is not in the blood, especially calcium, magnesium, high dosage of it if you're low on it, especially vitamin B complex, B1, 2, 6, 12, and 18, and all these B complexes. Vitamin C if it is low. One of the things they could do is to do a G6PD test to find out if that's the case. Now that we are having problem with other things that people are taking, such as vaccine and all that, we are seeing myocarditis. That too can get into the main artery and shut it down. And you could even have a heart attack, like so on and so forth. So these things, you could do a D-dimer test to find out if that's the case, if they're having anything like that, causing clotting in the brain.
Remember, health informations are only powerful when they reach those that need it. So if you know anybody that this will be helpful to, don't hesitate to share this with them. Thank you for watching.